know you're sitting patiently for your friends and stuff. And,
You know, I am a doctor, actually, and I'm going to let you in on a secret. Don't tell anybody, but when we come out of medical training, we're a little overconfident, really, in a naive kind of way. But that doesn't last very long when you meet the world. But you realize that medical school didn't really get you ready for everything you needed. Simple things like marketing. Like I started my own practice in Newark, New Jersey, where I practice. And I was telling my guys, sir, next time you come, I'm going to review your blood work and I'm going to be checking your prostate. So I wasn't getting a lot of repeat business, and I was wondering what's going on. I guess you have to know your community, right? If I was in Christopher Street, I'd be booming. I wouldn't be here. And then there's other things like, you know, competition. You hear about competition, the doctor next door, the doctor up the street, but it came from where I least expected it. And I'll show you. So I prescribed this birth control patch to a patient, and she comes back and she's pregnant. I'm sure the patch works, you know. So I say, what happened? And she says, you know what, doc? They told me that patch, it causes cancer. And I said, really? And who told you that? Oh, Marilyn, my hairdresser. So I said, So then I find Don Luis in the emergency room, passing a fat clot, you know, through his heart. And I said, Don Luis, what happened? How come you're having a heart attack? What happened to your medicine? He says, oh, my cholesterol medicine, doc. It's a full bottle. How come you're not taking it? He says, oh, Hector, my butcher, told me it'd give me liver damage. So now I realize that every butcher, every hairdresser, every bodega owner is a potential competitor. Not only that, but my patients listen to them more than they listen to me. They don't have to pay malpractice, and they only have 2 diagnoses. Every lump, every bump, every rash, every twitch can be explained by A, cancer, B, liver. And for this, you have to understand that Latinos, we love our liver. We will do anything. We will stop any medication if we hear that it may damage our liver. As long as we don't have to change our eating, drinking, or sexing habits, which stopping that lipitor doctor is going to kill me. You know? So one thing is for sure they teach you in med school is that history, the medical history is the most important thing. But it's a lot easier said than done, especially when you're talking about nature. You know what nature is? The GT, what women call the DT, the down there. Nobody ever tells you anything but, you know, I got an itch down there. Nobody will say it. So people are really not that open about it, right? So you tell a lady, hey, Shaniqua, you know, are you sexually active? No. Simple question, right? But with experience, you go like, I said, when was the last time you had sex, Shaniqua? Last night. But I don't move. So then you have the male version, right? The male version. So I say, sir, are you sexually active? And the guy goes like, you mean like sexually active? Like not right now, not here? And I said, sir, it says here you're here for toenail fungus. You know, it's not, and you're not my type either. So anyway, there's the times when the patients really make your day and give you a compliment, like you have to take a compliment when you really don't deserve it. Like this guy took a mole out, he goes back for his results and he's like really nervous. And he says, Doc, I'm here for the results of my autopsy. So it gave me the opportunity I was looking for. I closed the chart and I looked really scientific and I look at him and I said, sir, I don't even have to look at the chart. I know you're gonna be okay. He said, Doc, don't you wanna check? I said, no, it's okay, sir. You're gonna be okay. So I said, oh, Doc, you're the best. You have such a good hand. If I ever need an autopsy again, I'm coming right back to you. You know, but the thing is that people are funny, and so much of what I do, I'm a family doctor, so much of what I do is treating people with chronic illnesses that they really got in trouble because of their behaviors. But how do you make people change their behavior? Very, very hard, right? So I found 2 pieces of the puzzle, and I'll show you. Diabetes is a big problem, right? But you gotta check your sugars, And I tell my patients, you really don't have to die or have complications of diabetes if you take care of yourself. But otherwise, Don Carlos, you might get a stroke. What are you gonna do? Well, Don Carlos, you might get a myocardial infraction, like one of my patients calls it. Doc, you know what? You're gonna die of something. So I'm looking deep and digging deeper. I said, sir, you can get impotence. How many times, doctor, do you want me to check my sugar? Would it work better if I check it down there? So the first piece of the puzzle is motivation. You gotta know what makes people tick. So the second piece of the puzzle comes when, for example, one of our regular patients comes in and he makes an appointment without his wife. And he just came back from his hometown, Bolivia, Ecuador, South Carolina, doesn't matter. And I walk in and I see in the chart, chief complaint, personal. So I know it's a matter of nature, right? So I walk in, and because I work in North with so many different cultures, I am presented with a whole array of myths and legends as to how one contracts gonorrhea without actually having sex with anybody else but your wife. So once they vent, and we get through it, it's time for what we call a cheater special. Cheater special is nothing more than a culture of the affected area. And just as I'm about to prepare to collect my sample scientifically, we approach the second piece of the puzzle, which is called a teachable moment. I didn't invent it. We do it all the time. We know when the person is receptive to advice, and I know this guy is receptive, you can be sure of that. So as I'm going, and please remember, anybody else but your wife, and if you do, please wear a condom. So I know this guy heard my message, right? So at the end, he's going like, doctor, do you think I'm going to be bleeding? I said, well, I'm not sure, but I hope you're going to be faithful, right? So that's the second piece of the puzzle, to have people change their behavior. So what happens when you mix desire, motivation, Viagra, old age? Wonderful things happen in the minds of old people. I have this older guy, and he comes, he wants Viagra, and I'm not too sure he's the right guy for it, So I say, Maria, I'm not too sure. He says, somehow in his mind, he had it figured out that the sicker he was, the more I would give him Viagra. Figure out, I wanted him to have a happy day. So I say, Maria, I'm not too sure. He says, oh, but he keeps giving me all these weird symptoms. So I said, I think I'm onto this guy. So I said, Maria, let me ask you something. When you look to the right, does your left elbow itch? Yes, it does. Yes, it does. Doctor, you are good. So I said, I'm onto this guy. So I say, so Andrea, I'm asking you, did you have a fever? Fever? 150. I said, well, I was thinking of sending for a stress test, but forget that. We've gone through that. I said, the problem is, Don Adrian, that once the body temperature reaches 130, like Viagra just crystallizes on your veins and you can't use it. So he's like thinking, I said, I got him, let me see. So he's thinking. He looks like, he says, Doc, I think it was more like 126. So, what am I gonna do? Poor guy, I gave him the prescription. I figured the worst that could happen is he'd die happy, and he'd go with a smile, and an open casket, right? Thank you very much.